light therapy. And I quite like the concept of light because when you go out into the sunshine, you get the full spectrum. You get the ultraviolet, the near infrared, the far infrared, you get the light spectrum, and it's probably the best source to have. So going out, spending time in the sunshine without slobber and that whole, but in Australia they call it slip, slop, slobber. It's a campaign, so that they put all children full with toxins with those creams. Just go out and stay out there in a reasonable time, not 4 hours midday roasting and laying there like a lobster, just standing and half an hour out, and you don't get sunburned, you don't get any problems, but your body soaks it up. But I know England, Germany, and all those countries, it's kind of depressive. They don't have that much sunshine. And when I search for light therapy, the first thing that comes up is daylight simulating lights and lamps for people who live in depressive countries or dark countries, especially during winter. And it's not a bad idea because it really stimulates your whole health and immune system. But have a look, blue light goes very little into the body. And as we go down, green and yellow and orange, and then we are on the wrong side. Can we move us shortly to the other side? Then you can see red and near infrared, and then far infrared even further. That's why it's used for hypothermia. That's why it's used for saunas. So near infrared doesn't heat up quite as much as you have, for example, a red laser. Doesn't get really hot or warm, but it penetrates deep into the body. And the more you go deeper into the body, the less light you have and the more energy is used up to create that warmth. Okay. Normal applications, eyes and skin. And with that intranasal, it's actually opened up a whole range of new applications. Now, laser doesn't penetrate into the brain. The 655 doesn't go past the nasal cavity. At night, you look like Rudolph the Red-Nosed Reindeer, and you glow with your nose, and you can do it on this side, and then you do it on the other side for each 10 minutes. And that's cool because you really stimulate your whole blood flow in that area. And as you can see, it's really covering all those fine capillaries where the blood is actually slow, so that you have maximum penetration. And this is far superior, even in effect, than if you have IV. And it doesn't require needles, for those of you
Which is a good thing
have
sometimes.
a phobia. And it opens up that part of the brain. Now, I just need to go back shortly, and I'll have the same slide. When we go for near infrared, that penetrates into the brain. It actually goes transcranial through bone, through cartilage, and behind your nasal cavity is quite some soft bone and cartilage where it penetrates through and reaches into the brain. And we'll talk about that.
The differences, yeah.
Transcranial and intranasal are new application. Well, new, 5 years,
Newish.
10 years, newish. But they have proven to have really, really big
Astounding
effects.
Next.
The 655, it's called blood photobiomodulation, in case you want to take it in the big word. Boost the immune system, and I think that's the next slide where we have that in more detail. No, yes, we have. That's Deborah will report on that. But we have that flagging of pathogens. You remember? You have a pathogen, that is a bacterium, and that floats by that red light, and it grows green hair. Remember? Yes. So as soon as they have green hair and they go on, then the immune system, which flows by that red light and goes like, oh, energy. And like they take from the hemoglobin from the red blood cells is charged up as well. Then you have from that more charged hemoglobin, more oxygen, more supply to the immune system. Immune cells are activated and live, and then they can attack all those guys with green hair. It's a chain reaction that works in one way. And that's why that 655 is phenomenal. It's not a treatment for your nasal cavity. It's not a sinus treatment. It's a systemic therapy. We treat the blood, and because the blood is at the surface of your, that's why when somebody hits you on your nose, you bleed. It's right at the surface. And that's why that's the application area where we use that red light.
It's also the least invasive.
Exactly. Now, you can see here, it's nose or arm. I prefer my nose. It's really easy and very, very simple.
Long list of benefits. So we've actually got 2 slides on this, which you guys can actually read on a blog post that was done on this. But the biochemical effects on cells to increase mitochondrial function, so it increases ATP production.
We're both always just half-eaten.
Mitochondrial function results in cells to function more efficiently, so repairing damage, rejuvenating themselves, as well as restoring the cellular level of function. Stimulation of DNA and RNA. It promotes anti-inflammatory and antioxidant defense.
I just decided I make myself pretty. I just heard what it does.
It activates the lymphatic system. It increases blood flow and circulation, which will explain how all of these link into different factors afterwards. Formation of new capillaries, which is amazing. It also boosts natural production of collagen and fibroblasts. So if you've actually heard of red light being good for anti-aging, wrinkles, cellulite, that is all very true. It restores and repairs damaged soft connective tissue. It increases quality of life, decreases pain, muscle spasms. Really big function is actually Hashimoto's, so hypothyroidism.
It's not hyper.
Nope, other way around.
Very important. If you have a sleepy thyroid, then that's where you need it.
Yes, not so good for the hyperthyroid. It actually supports the regeneration of damaged tissues to the thyroid and therefore improves the function. It works incredibly well. Stimulates and decreases inflammation. It supports weight loss. It reduces oxidative stress and increases melatonin, so better sleep. And then again, the cognitive function, which we will go into more depth in later slides.
And one of the nice things with red light is it actually makes you feel really good. You feel after a very short time so different. Pain, stress levels, tense muscles, everything relieves. And then we tested it out because we got 10 of those to check it out with our community. And the results that they had with pain relief and relaxing, and especially patients who have Lyme disease or any infectious diseases, and they have that struggle, with nerve damage, and they put that on. Whoa, it's just like a massive relief. So it's certainly worthwhile doing, and it's a small expense. That light, this size here that I have, is, as far as I know, $420. I think you can find them on the link, and we'll put those up in a moment. But that's a big size. Sabrina uses the full body, the very big one, and she says it's awkward to handle. It's really big, and you never stand in front of it. You always sit. So that half body size is great. Cool. My grandma, my mother, not grandma, my mother, grandma. Your grandma, is using the small one, and she has hypothyroid. She has a lot of skin problems. She loves it. So it's something that you will find is used quite regularly. It isn't an effort to do. Haha. When we came to a clinic and they were doing hyperthermia, full body hyperthermia, heating up the body to high temperatures, they said, we had in the beginning problem to promote that to our clients. And they were like, do I really have to? And I don't want to. And they said it's really hot. And then we discovered that patients who do that 2, 3, 4 times actually release cellulite. It straightens out, the thighs, and it makes beautiful butts, and all the cellulite disappears. And he said, that was the best argument ever. Oh, I would like to have a second treatment this week. Can I have more? For beauty, most people do a lot. And that's why
very true.
When you look at the image, and I'll move myself, that those extended fat cells that are underneath the skin, and they are stretched, and they create those cellulite bumps on top. It's toxins and the fat. And as soon as you start putting that heat into the body with red light, or even stronger with far infrared, then they start to detoxify, release, and flush out, and cellulite disappears. So that clinic has actually now opened up a second stream of patients that they treat for cellulite with hypothermia, and that's sold out far easier and far faster than the one for cancer.
It's anti-inflammatory, so it actually helps to bring down those inflammatory pathways by reducing those pro-inflammatory cytokines, and it actually increases your anti-inflammatory cytokines. So it's excellent for any inflammation pathway. Thyroid, so this is a really big one and an amazing effect. I actually have 3 clients who've been using the red light and have actually reduced their need for medication. So as you can see here, a Russian study actually conducted the red and near infrared light therapy for 10 sessions with 347 women. They all had hypothyroidism, and their TSH was at around 9.1. And after just 10 sessions, the TSH actually normalized in over 90% of women. And
97, that's
so very
almost
high.
100%.
Yes. And their TSH actually averaged at 2.2. So that's, though there's lots of studies out there, but the actual effect is enormous.
And I would like to mention here, because we always see things so isolated. I have hypothyroid. Well, your thyroid is responsible for all your enzyme production for digestive system. There's so many factors that are related to a healthy thyroid that all diminish as soon as that doesn't work. So that whole concept is not focusing on the disease, but looking at the overall. So even as preventative, even as if you're slightly out of balance, to bring that back will restore your gut health, will restore your digestion, will do so many more things than just repairing the thyroid.
Well, remember, the way the red light and near infrared light actually works is by addressing the root cause, which has affected the thyroid in the first place.
Exactly. And I would like to mention here very short, these lights, and I said that to you before, and it's really sad that we can't see that. Those lights, they have 2 buttons down here, and you can see, just turn off the slides very short. They have 2 buttons down here, and if I go the red light, you can see that's very bright, very brutal. If I turn on the near infrared, you don't see that. But there is actually every second bulb in here is near infrared. So it doesn't produce a lot of heat. You can feel it with your hand going over. But if you keep that, let's say, 20 centimeters away from you, you set that on the table, you actually feel that warmth, you feel that energy. And then adding the laser light, it's the combo. And that's because so many people ask, what do I need? The laser or the near infrared? Do I need the red light? Oops, turn it on. The red light or the invisible warm? And it's the combination. It's actually the combination that makes it work just laser alone works for blood stimulation and immune boosting, but it won't have those all healing effects. Whereas if you add near infrared, and you can see that it just penetrates deeper into the skin, that's when the laser light actually excels.
Very synergistic.
So they work really synergistic. That's why you find all of those lamps having both. Now, when you do the near infrared, the laser here, it actually pays. Go on. It pays to turn on the near infrared as well, and you get both, and then you do them, parallel or one after the other. And they have different attributes in intranasal as they have external.
Just in case you don't want both of your nasal passages.
Don't do it one after the other. But it actually, the synergistic effect makes the laser far stronger. And that's why they combine it with that pulse. Good.
Great. Just shortly, all the questions on how do you decide between which one, we will get to that. So the next is antidepressant and anxiety. So it actually works amazing for our mental health. So it improves the symptoms and severity of depression and anxiety. So they've done different studies where they've seen how it's dropped major depression as well as anxiety in different clients, and sometimes both, depending on what the patient came in with. So just in 2 weeks, well, that wasn't that fine. Just 2 weeks post-treatment, 6 out of 10 patients had remission of depression and 7 out of 10 with their anxiety. So just 2 weeks to actually see those massive effects.
And that's, again, coming back the same with PEMF. You have the same results by holding that big loop around your head and treating the brain, and it has the similar stimulating effects. So it's really beautiful to see that we have tools at hand for incurable chronic depression. Just saying it because we don't have a pill for it is stupid. It's really stupid. Joint health. We all know that that's a big problem. I wouldn't call it the first line of defense for joints.
No.
Because you would use prolotherapy, ozone therapy, you would PMF. It's not the first line, but it has shown really good results. So that's why we need to mention it.
Fibromyalgia and chronic fatigue, again, because it increases your energy, mitochondria, and ATP, that it actually really works well for those types of conditions. And it has been found to be an amazing adjunct treatment to everything else you would do with those two. Sleep, so it actually increases your melatonin, which is a hormone for better sleep. And it also reduces mental stress, again, depression, all the factors that could also be impacting sleep.
I would also like to mention, when you look at sleep, when you go to bed, your body has a massive job. It's actually the biggest job of all. Repair, detox, mending, tissue repair, getting rid of all the different cells that have died off. Every cell divides, and all the others go out into the poo. So it's a massive job. And the biggest problem is when you go to bed and you don't have enough energy, then your body has that restless leg syndrome, rolls you around right, left, until you can go finally to sleep. And that's why filling the body with energy before you go to bed with PMF, with hypothermia, with a sauna treatment, or with light therapy really enhances sleep.
Improves brain health, so it can actually prevent degenerative changes in the brain and slow down the progress of traumatic brain injury, ischemic stroke, Alzheimer's disease, Parkinson's disease, as well as age-related cognitive decline. And that is a huge part of actual red light therapy. Again, just following on, neuroinflammation is a crucial pathophysiology that is found in brain disorders. So red and near infrared light can actually work on, like we said, that inflammatory pathway, but very specifically in the brain.
And that brings us to the next frequency. 810. Now, I should have put the chart there that we had in the beginning. 810 is at the just outside the light spectrum. And as soon as we go outside the light, that's why when you turn this thing on and you put on the 810, this one is here, then you see a tiny little blinking red light. I don't know if you can see it. If I put it close, maybe it's a bit blurry, but it's a tiny little blinking red light. It's just borderline spectrum visible. And that pulsing is actually done in a frequency that is absorbed by the body as low stress, as normal active body healing function in that 7.9 Schumann frequency. So when you absorb that infrared light in that pulse, you can see in the next image that it penetrates into the brain.
Which is why mental health is a huge factor.
It's a massive transformation for mental health. It stimulates nerve repair. It activates memory and cognitive functions in the brain. It protects nervous system settings.
Stimulates the rebuild of new synapses.
Exactly, and increases deep sleep cycles, which again, really, really important. Okay. So when we look at the 810 and we use that in the nose, you shouldn't do that the whole day. Just stimulate, put the energy in, and then let it work. A lot of people ask me, how often can I do that? You know, more
is not always better.
Is not always better, like Deborah says. Does not always help more. But the main focus is that you need to try for yourself. See, depending on your sensitivity, do it twice in a row and see what it does. I always say we need to learn to listen to our body. If I get a headache and I feel tired, then it was too much. If I don't, well, maybe my body needs a bit more. So listen to that and play with it. In general, it's recommended twice a day, morning and evening. Now, for those of you who say, I would like to have a lot more power because my brain is failing, my mind is not working, there's lots of things that aren't working really all that well. You can see here, there is very strong, and they are much more powerful than the nasal part, those transcranial lights that sit here in that headset, and they go directly through your brain, through the skull bone into the brain. And we did some of those, children helmets that they put on, and it's a very awkward fitting helm, but you have here into the frontal lobe, and then the other way into the 3 parts of the brain, where you stimulate with near infrared that energy field, and it just activates your repair.
So anything Alzheimer's, Parkinson's, it's phenomenal for that.
And there's studies. We've not invented that.
Nope.
It's actually a very well-researched subject. The biggest problem was to go transcranial requires quite a bit of energy. So you have here a bigger device that you hold, and you go through the nose as well. So you cover the frontal lobe, amygdala, all of that from the front. You come here from the top. You come here from the back. Very, very effective treatment. And instead of doing it daily for 2 or 3 times, this device is used mostly in clinics, and you just do it twice a week, 3 times a week, with far stronger and far more effective results. So I had several clinics buy one, and then they bought a second, and then they bought a third, and then they bought bulk, and now they are sending it out to their clients because the results that they had just self-propel. Like if you go somewhere and somebody has results and the mind clears up and they're better functioning, tremors go down, all of that really makes you talk about it and share it with your friends, which is always, a benefit. And you can see here how it stimulates the different parts of the brain as it goes in. Mostly Alzheimer, Parkinson's, depression, MS, ALS. ALS needs to be stopped as soon as you have the first diagnosis, as soon as you know that there is something wrong. It's bacteria in conjunction with heavy metals eating up your nervous system. And it's a real race. You need to cut that down, heavy metals out and infections down as fast as you can, because nerves, once destroyed, don't really grow back fast. And therefore, the impairments that you have until to that moment when you can stop it really don't recover. So if you have a diagnosis of ALS, and I will next year focus with 2 practitioners that treat ALS very successfully in Germany, focus on that a bit more with a few interviews, because that is something very important to target as fast as you can. And again, what do they use? Ozone, hypothermia, PMF, and laser or red light, near infrared light. So fantastic to use for so many different diseases in one therapy. Do we need to go?
We've essentially covered this again.
We've covered that.
There is a large margin of safety, so there is not a lot of, or actually, I don't know, any contraindications, side effects. The only one I know specifically is that if you have hyperthyroidism, that it can activate that too much.
Yeah.
That was probably the main one that I'm aware of.
They wrote pretty much all neurodegenerative diseases, including Alzheimer, Parkinson's, which are the most studied, and even multiple sclerosis, it responded
The
well.
only other thing that I've heard is when they've got the actual electrodes implanted in very severe Parkinson's cases, that is a contraindication.
Yes.
Overview.
So that's what you asked before. Which one should I get? It really depends. What is your main focus? If you would like to stimulate your immune system, flag pathogens, make this whole system more vibrant, get more oxygen into your body on a daily basis on a small budget, then the 655 is what you want. That's nasal. 655 nasal. And let me I will put the offer. It leads you only to the store, so don't freak out. It's only when I put that offer up, you can go to the store, and that shows you all of those treatments, and you can select which one you want. V-Light is very, very fast, so they ship out same day, next day, if it's not a weekend. But they are very fast, and you should normally get that device in time if you want it as a present. The 655, immune stimulation, immune boosting, activating the flagging of pathogens as a trickle feed as often as you like during the day, just to stimulate, to give you energy. Again, also that's why it improves sleep, because you feed your body with energy that goes straight into the whole systemic body. It's not a nasal treatment. Okay? Got it. If you want to treat externally, because...
Well, for this one, I would say thyroid, easiest because you can just sit it in front of you. I would say for anything thyroid related, anything full general body exposure, so skin, any rashes or anything you've got in the terms of skin conditions, and just a general device, I would say this one.
Also for pain, it's really nice. Joints, chronic depression, fatigue. All of that. Sit in front of the light, do your meditation, do a nice breathing exercise with it, and you will feel the energy really transform.
And that one you can really build into a routine. So every morning, sit in front of it for your 20 minutes.
Exactly. And it's the same price as the nasal laser, the 655, and it really helps. Now, if we go for the 810, as you can see, the 810 and the neurogamma, which is both the same frequency, so they both do more or less the same. Sorry for that. Yeah. So they both do more or less the same. The 810 as a pocket device you can take with you wherever you go. It's easy to use. You take it out when you feel the need, and you just trickle feed your brain and your nerve repair. If you want to have faster results, if you have a clinic, if you see more patients, if you are a retirement home or a retirement village, an aged care facility, that's where you want this. And then the first one gets it, the next one, and you can do it while playing bridge, and nasal laser in, and they have all their treatments.
Honestly, if you've got Alzheimer's or Parkinson's or really a major depression, I personally would always recommend rather you get a group of people to purchase the Neurogamma, because you actually will see those effects much quicker, especially when you've got a degenerative condition like Parkinson's or Alzheimer's.
Good. They always say I shouldn't make pictures like that and publish them. But I think it's okay. Too late. It's out there. I don't need both. My brain is sharp and crystal clear, but I do so much other things, and I do regularly ozone. I'm now 10 months full into ozone without stopping, and I love it. It actually is the first time that I feel every system is rebooting and restarting. Combined with PMF, that will do for me. Hypothermia as a once a month at the moment, maybe every second month, because I'm fit. I'm doing a lot of sport. I'm active. As soon as I feel that my body goes into those aches and pains and doesn't work anymore, or has some problems, or inflammation markers go up, the brain gets dull. As soon as you have inflammation, you will find that your body goes into a fear state, into a panic state, into, how do we turn that off so that we can see? Slide presentation is over. And that's a bad picture to leave us behind me all the time. But see, everything is systemic. If you have inflammation, you will have greater fear, greater anxiety, more aches and pains, more depressive. It's like something that has a chain reaction. If I don't have enough oxygen, I always go into that frantic mode. I had this morning a phone call with a lady, and I could hear from the way she was talking, she could hardly get air. It was all panic. When you breathe, when you are in fear, what do you have? A very short breath in and a short breath out. Shallow breathing. So there's so many things to combine. When you do any of those light therapy treatments, use them at the same time as a breathing exercise. Fast breath in and slow breath out. It calms the nervous system. It reduces inflammation. And combination with light, you have a nasal laser in. Use it to bring in the oxygen that is then activated in the red blood cells. Healing is not just a treatment that you do. It's actually a philosophy that you incorporate into your healing. Yeah. And that really makes a massive difference. Okay. And that brings us to questions.
All right. So first one, I have polyps in my nose and have had 2 operations to remove them. They are back again after 6 months. I also have asthma, use a steroid spray, anything I can do here at home with ozone. Yes.
I
would say ozone breathing is excellent for that.
Always clarify that.
Through oil.
Bubbling through oil. Don't do ozone breathing. I'm so used to
saying that.
Bubbling through oil. What you can do too is get a bottle of that, for contact lenses. It's the oh God, how do you call it?
I'm not sure which one you're talking about.
The saline solution,
saline, yeah.
0.9% saline solution. And you bubble ozone oil through that, and then just fill that into a neti pot and run that through. Very effective. I didn't give it enough credit when I was talking about eye drops. You know, most degenerative diseases are always in combination with bacterial or viral infections. Every nerve degeneration is based on bacterial infection. So using eye drops, using ozone saline solution as a neti pot, breathing ozone through your olive oil and bubble it through, all those things help. Now, I had several phone calls with people not training before they do the ozone insufflation with sinus. Train it before you do it live with ozone. Just fill your syringe with air or with oxygen, and then really do that before you do it live. Hold it, breathe out. See the motoric of fingers and pressing and everything, and what do? And then that ozone goes up, and it's sharp. It is a hit that you feel, and then you breathe it in, and then you're sick for 2 days, or you're coughing like crazy. Don't do that. Do it with oxygen. Then do it with the thinnest concentration of ozone first, so that you get a feel for it. And then slowly build up to a quarter setting, to 40 milligrams per liter, and then do it gently. You can do so much. Polyps are mostly based on bacterial overgrowth, isn't it? A viral.
Asthma. So are you eating dairy? Avoiding dairy, very big one in any asthma case, and also glutathione levels. So, for example, the black box has a sublingual glutathione spray, which is really, really good for anything related to polyps. All right.
We don't have a clinic for health, and we don't treat. See, we are a family, just like probably you, and we've been traveling around the world learning how to help a friend to heal from cancer. And because doctors don't tell you what you need to know when you come there as a patient or as a client, because you're paying, so you need to get treated, we went there with a camera and said, we're doing a documentary, and I'll be in a documentary and I'll be published, and they share a lot more. And we found that to be the most effective way to learn. What we do is we share what we've learned in our program. That's the main business that we do. We educate health coaches, practitioners, functional medicine doctors, with all the things that we've learned. And it was not just a short trip. This was a 10, 15-year research project. We were hired by a clinic to pack everything that is relevant for cancer and chronic degenerative diseases into a protocol, how to test, how to find out, how to deficiency, which treatments work under which condition. And all that is in our coaching program. So if you want to learn that for yourself, cool, you can, but we don't treat. Treatment is to those with license, and coaches learn so that they can help the patient to select the right person who has a license to do that particular treatment.
And even if we do take clients, it's over online, Zoom or Skype, which means you still need to be able to do all of those things externally.
Yes. And that's why the whole focus is to help you, instead of going for a treatment and then you pay bucket loads of money for each treatment, you learn how to do it yourself. And when you learn how to do it, you can do it for, these lamps have 50,000 hours. Now think about, you do half an hour a day, maybe an hour, 50,000, calculate that by 3 times a week or 5 times a week. You can pass it on to your grandchildren.
All right. Next question. I have a truly healed dome, infrared sauna. I've gotten my temperature to 105 degrees, which is, I believe, 40 degrees Celsius. And how often is it safe to raise the body temperature? and how high do I have to have the best effect, and how often?
Okay. How much did he get it to?
40 degrees.
40 degrees. That's
Celsius.
cool. That's all you need. 40 degrees is great. See, Lyme disease, Lyme spiro, whatever they're called, Lyme bacteria, they die off at 41.6, which is extreme hypothermia. They usually put patients into a dome under sedation. They have a doctor monitor the whole time. They have heart monitor. They have all the revival gear, and to be very honest, out of 10 clinics, 1 or 2 offer that kind of intense hypothermia. It's very exhausting. It's very intense. It's also very stressful. And the problem is you kill off a lot of bacteria, but the problem is that they all then need to be detoxified and get out of the body, and it overloads the immune system. That's why they combine it with apheresis. Apheresis is a blood wash. Blood out, washing, filtering, separating white blood cells and red blood cells and plasma and pulling out the toxin, and then they mix it back together and it goes back in. Apheresis is a very advanced filtering process of your blood. And again, we don't have that possibility to get those toxins out. That's why I would say 80% of the clinics do rather long-term moderate hypothermia, like you do, bringing it up to about 40. And that stimulates your immune system, and your bacteria get flagged with heat shock proteins. Number one, they don't multiply. As soon as your body temperature is above 39, they don't multiply. They're actually weakened in the heat. And then you have more immune cells, so just do it longer and stay around the 40 per treatment, and combine that with good vitamin C or with anything that supports the flush out of toxins and to get rid of all the neurotoxins in your system. Plus, and there's a video on the OZONE page, Dr. Rao explained that most patients with Lyme have very, very low amino acids and glutathione levels. And so deficiencies, check out if your zinc levels are good. And talk to your doctor to do it in full blood if they can, so that you get proper values that are not half off.
And in terms of how often per week? Once a week.
Once a week. The effects of hypothermia usually last 2 weeks. So Dr. Rao said when we do 1 a week and we build up, we actually really increase the efficiency over time. If you combine it with OZONE, you really have, it's a long stretch, and depending on how far you are progressed, it takes a while, but it certainly leads you to a healthy end.
All right, got lots of questions, so I should probably not be so slow on them. Yes, OZONE helps with Lyme disease, which you just answered anyway. All right. SIBO, terrible gas, pain every day. Treating the cancer naturally, no chemo, but feel that we're being derailed by the painful SIBO symptoms. Any suggestions? All right, so that sounds like quite severe SIBO. Sometimes when SIBO is really, really severe, I'm going to actually admit that sometimes antibiotics are very beneficial to get back on track, and then going in with rectal ozone insufflation to get that real systemic effect, supporting with all the different nutrients to support your gut, and also support something like ozone therapy's elimination of those overgrowth.
Find a local practitioner. If you are very advanced, you can do 10 pass IV ozone.
Yeah.
So go to the clinic and they take blood out, ozonate it, put it back in, take it back out, ozonate, put it back in. You get what you probably achieve in 4 weeks or 3 weeks of ozone rectal insufflation in one hit. And it helps with bringing inflammation markers massively down, helps with the die-off of all bacteria. It's a massive hit. We can't do that at home, but You shouldn't do that at home, but it certainly is a helpful possibility.
Yeah. What is the cost for PMF?
Click on offers. I'll just link you to, again, there's no...
And we actually have a function now where you can change the currency, which is my favorite.
Can I ask you to click on the offer for laser LED, that you go there? Because I'll remove that offer to open up the PMF offer, and then it's gone. So you want that link open because of the special pricing. So done, remove.
You can always put it back up.
Exactly. Start offer. That's the PMF link. So you can click on that. Again, it takes you to the overview page. Clinic Mono for home use, Clinic Duo for luxury home use and clinic use and small wellness center use, and everything that you would like to treat really fast and effective, the Clinic Duo. The PMTs are really more for professional use, or if you have racehorses or sports people, athletes that really need, or many people that be treated in a short time. That's when you want to go to the PMT or the PMT Duo. Again, there is a lot of explanation on that page that shows you how to do that. Okay. Right. Publish. I forgot to publish. Now question. The link is up.
What equipment do we need to be able to do hypothermia treatments at home and light therapy treatments at home? That depends on which light treatment.
Okay. Hypothermia is really, really easy. You get the dome, and it comes with the iCelsius, which is your rectal probe to keep you safe, so that you can measure your body core temperature absolutely accurately. They are calibrated, so they are absolutely straight. And when you see 36.6 then, or 37.6, then that's the temperature core body. So you insert that, it's about that long, a metal pin, much thinner, so it's not as thick. You insert that into your rectum all the way in, and that gives you then on your iPad or on your Android or on any device your exact temperature reading, and it follows through. Anything but that, towels, you get 3 towels, but you still need more. You sweat like crazy.
Your organic long pajamas.
Organic long pajama, and then Basica and vitamin C and everything that you take as a supplement. And then go into the dome. Really, really beautiful. Nothing else. It comes all in the box besides your supplements.
Carol, in regards to your question with how long with daily use until you feel a difference with the lights, like some of the studies showed, between 10 days and 2 weeks is actually where you start already seeing effects. Again, dependent on how consistent you stay.
That's a given.
Yes. Is it harmful for cancer, causing them to grow? No.
What?
The lights.
No.
Well, I assume that it is.
Okay, yeah.
If not, please clarify. Can you tell me if it is possible to do hypothermia by yourself, or do you need another person?
Yes. I really recommend don't even try. Having a second person that cares for you, looks after you, cools you. Go to the hyperthermiaacademy.com. Hyperthermiaacademy.com. Then go under patients and scroll down, and there is Trish having Michael has hypothermia, is a very nice one, has his first, and Trish explains really well. It's a treatment where you want a second person to be there for you, to look after you, to care for you, to cool your head. It's not nice without.
No, and you want that support as well. All right. Everyone who's typing in the chat questions, please flag them because I'm reading out of a different section. Some saunas have a red light built in. Is this recommended?
Yeah, it helps.
How do you decide between the intranasal laser and the red mito red light? That one, the bigger one.
External skin and eyes are closed, so it's more like through systemic skin absorption. Like I said, hypothyroid, fibromyalgia, chronic fatigue, all of those things, I would use the mito light. If you want to have an immune boosting therapy that is really covering all of your blood, then you need the 655.
I really want to do the hypothermia. I have lung cancer, but I need someone to monitor me, correct? Yes.
And care for you and look after you, yes.
And what is the protocol if you achieve a fever?
You celebrate and you enjoy the fever and you let it do its work.
Go to bed.
Once you have the fever, don't cool it down afterwards. Get out of the dome, have a hot shower so that the fever stays in your body. Go to bed, wrap in blankets and say, I'm out for a day or for a night. As long as you can hold the fever, as long as the body is enwrapped into that extraordinary detox, you have effects. See, that's why most of the people do this treatment in the afternoon or evening, because it just gives you such a sound sleep. The next day when you wake up, you feel like freshly born. It's pain. We had in Las Vegas a workshop and we had 10 people go, or 20 people go through the treatment over 2 days. And we asked always in the morning, how was your night? What was the feedback? How did you feel? And every single person came and said, my God, all my nerve pain, all my arthritis, all those things completely gone and painless sleep. So very, very powerful. You know, I have the least profit on that stupid hypothermia dome. It's the hardest sale because people are afraid of fever. And yet I haven't given up in pushing that because I really believe it's the best treatment with, how did I say when we started, the biggest bang for the buck? It really gives you, ozone is slow and it always works too. So it's really cool. It's for low budget and mega effect. It just takes longer. Hypothermia goes quite fast, but you need a second person and it's more effort.
All right. Another question is, are they working on a version that is programmed with pulse frequencies?
A Sonadome?
I'm not sure.
Oh, look, there is huge advantages and advances in technology and everybody combines everything. Like they use ozone in steam saunas with PMF and all of that. You know, that's marketing, that's money. I have something someone else has not. I have better treatments and forget about this whole crap. We're not in a gadget race. We are trying to heal disease. A small ozone generator, that's all you need. You don't need fancy gadgets around that and measuring how exactly does it do the ozone. Even calibration for what you do at home is absolutely useless. See, if you do with an oxygen concentrator, you can't even regulate that fine. So all of that is money-making business. If you go for hypothermia, they do it in nature with sweat lodges, and that's bringing up your heat and your fever. You can do it in a bathtub. If you've heated up, it's very exhausting. It's a lot more difficult to get to temperature and to bring it up, but it works as well. Fever therapy is the simplest form with the dome because we just induce it. In 20 minutes, you're up. 30 minutes, you get into fever. And that's why we've chosen that path and because they do it in clinics. Again, it's one of the most documented therapies on the planet. PMF, you know those old PMF, the ones that kicked you almost out of your chair? They were fantastic and they worked. Now, as we go into the legal environment and having protected patients and safety and CE and UL and Health Canada and all of that, it becomes really complex, but the effects have not changed. They do the same thing. So don't try to go into that gadget race and think you need the newest and best combination. It doesn't enhance more.
I missed the PMF talk. Any chance that is available as a replay?
I will take all 4 now and put them into one series where you can go in and you have the slides, you have the checklist, you have the download, and you can learn step by step every part that we spoke about.
All right.
And you can wind back and forth. Now with the webinar replay, it doesn't really allow you that. So it's kind of annoying. What did he say? And you can't go back. You have to restart from the beginning. So we will fix that.
Yes, and someone said we have very hard to understand accents.
Arnold Schwarzenegger is back. They write underneath my videos in YouTube.
I'm fighting severe chronic fatigue, Lyme, and mold. Is hypothermia hard on the adrenals and might make me worse?
It will not make you worse, but it might be a tough treatment.
Yeah.
Start with ozone first. Build up for at least 6 weeks, really putting ozone as a top priority.
And then support with adrenal nutrients to really feed with ozone together.
Exactly. Yeah. And then you can go into the dome. It's like I said, we don't stress your bodies even more, especially with adrenal fatigue, but it is not contraindicated. It's actually very helpful for your adrenals.
2 people have asked about the coaching program. If I put in my email address, send me an email, and then I can give you all the info for that. I think I wrote that right. Simply outstanding. Love the webinar and YouTube videos. I currently use the 655 nasal laser and a small PMF. Wonderful.
Okay, let me know, very short, just write in. If you use this equipment, do you feel a difference? If you already have a dome, do you feel the difference? Let other people know. See, we can tell you a lot of things.
It's your experience.
It's your experience that actually matters. We have done a lot of tests. We don't recommend anything that we haven't done. The whole family, plus at least 10 friends and people that we know that are sick, before we even consider advertising. And so if you have, just let us know, write down, yes, I'm using and I love it, or I have no results. You know, honesty is really key.